Okay, we are recording now. It is Friday, November 7th, 2014. We are here with Dr. Kaiser. Is the AIE Boot Camp, Fall Boot Camp 2014. I'm going to ask him a few questions. What is your experience with, oh, I need to take
You
that.
want to give this back?
Yeah, it might help.
I can hold it.
Okay, what is your experience with dental implants?
Clinically, my experience is only restoring them, in terms of prosthodontically restoring them. I have not placed implants.
Okay. How are dental implants beneficial to the patient?
Main thing I see them being beneficial is they save bone. I mean, they obviously provide chewing modality, but they save bone.
Why is it important to operate on the live patient?
Well, the live patient, has to swallow when they're breathing and their tongue's moving around, and they're, obviously got to keep them comfortable. Besides that, there's always the issue of the hydration factor. If you're on a cadaver, then they're not alive and they're not hydrated and don't have the same volume. And if you're on models, well, okay, really.
How is it beneficial to learn on live patients under the direction of Dr. Michael McCracken and Dr. Guy Rosensteel?
Very beneficial. I'm actually 7 out of 9 classes through the MISH course at this time, and I have, as I said earlier, I haven't placed implants yet. So if you think about that, I'm that far through the MISH course and I haven't placed implants, and the reason is because I haven't done it clinically. I haven't had anybody beside me. So this has been invaluable. You can know something in your mind, but that doesn't mean that your fingers know it.
What benefits in your personal practice do you foresee by taking the AIE boot camp?
Allowing me to be able to place some, at this point in this training, allowing me to place some straightforward application implants. And then, of course, I've learned I can come back and learn more and get more advanced.
Is there specific information or technology that you've learned through the course that you didn't know previously?
I pretty much had a good understanding of how to use CAT scans. I've had a CAT scan machine for 2 years that I have some specialists send in their patients and we take the scans for them. So technologically wise, I pretty much that's not been my deficiency. My deficiency has been that I've never laid a flap in my life. I've not taken out that many teeth, so my whole growth and gain has been, what do you see, what do you think, what do you feel, how does the patient experience it, and how do you manage the patient and the bleeding, and etc.
How is this course different than other dental courses?
Well, the main thing is that it's live patients, and the other main thing is the experience of both the staff that you all have here and your doctors, and the residents are invaluable. You've got people around you at all times that you can ask questions.
Can you tell us about the clinic and the staff?
Well, jumping off of what I just said, they're very, very good. The staff is very helpful, very organized. The residents are very helpful. They jump right in and will look and help guide you. Of course, the doctors are, I say the doctors, Dr. McCracken, Dr. Guy there. They do a very good job of guiding us, giving you ideas, helping you think through the problem.
Mm-hmm. Is there anything else you'd like to add?
I greatly appreciate this institute.
Thank you so much for your time.
Yes, ma'am.